Hello everyone. Today we are going to discuss about the national and the international organization or agencies which are going to be related to the child health. This topic is going to be come under the unit 1 and it will be more useful for the students who are studying BSc third year or PVC first year, and for the MSc students it will be very useful. This is coming under the syllabus according to the IMC. Now we are going to discuss one by one. Now we are going to discuss about the definition of a little bit definition about the agency. Why the child welfare agencies are developed in India or any part. So what is their point of developing this? So usually they are going to be a administrative unit, and they are going to work as a social work. Okay, so it's a social work, and what you are going to do means they are going to mainly concern about the welfare, vocational trainings, providing of the services. Especially they are going to specifically focus on the children's. Okay, so everything, all the welfare, all the vocational training will be given to the children by these agencies. So what are the purpose of developing this welfare agency? So first one is for the educational purpose. So already everyone knows that in India, the illiterate people or literation or education of the children is very low. So to improve the education of the children, to give the education to the children on freely or at the affordable price, they are going to start this kind of agency. And next one is they also conduct various kind of research which are going to be useful for the children's. And next one is they have to train. Okay, they are going to train for the training and education purpose of the teachers. So teachers are going to handle the children in the school. It is very necessary to train them how to take care of the children and how they have to teach. Okay, what kind of methods they have to use. For that purpose also they are developing this kind of agencies. And next one is provide health support. So health support they provide, so children who are on need, who no one is there to take care, or they need financial support or any kind of health supports, they are going to provide. And next one is ensure safety of the child. So the child safety is the priority that is given by the any agency, child welfare agency. So usually they are going to focus on the various rights. Okay, and they are going to keep in the very safely environment, prevent from the any domestic violence or any kind of harassment to the children. And next one is strengthening of the family to successful care for their children. So this is the last purpose, that the giving health or education to the children is not enough. So at home mostly the family members is going to take care of the children, so it is necessary to give strengthening or any kind of education support, psychological support to the family members. So this is also going to be given by the healthcare or child welfare agency. Now we are going to start discussing about the national child welfare sub agencies. So under this, first one is Indian Red Cross Society, second is Central Social Welfare Board, number 3 is Indian Council for Child Welfare, number 4 is All India Women's Conference, number 5 is Bharat Sevak Samaj, number 6 is Hind Kush Nirvaran Jha, number 7 is Kasturba Gandhi Memorial Trust, number 8 is Family Planning Association of India, number 9 is All India Blind Relief Society, number 10 is St. John Ambulance Association. Number 11, Tuberculosis Association of India. Number 12, Ford Foundation. Number 13 is Smile. Number 14, SOS Blaze. Number 15, Child in Need Institution. And number 16 is CRY. So it means Child Rights and You. So these are the national agencies. So one by one we are going to start discussing. Some of the international agencies are WHO, UNICEF, International Red Cross, FAO of the United Nations, World Bank, CARE, USAID, UNFPA, UNDP, ILO. So now we are going to start discussing about the National Child Welfare Agency. The first one is the Indian Red Cross Society. So it is established in 1920 and the headquarters is in Delhi, and till now throughout the India they have 700 branches. So the first activities of Indian Red Cross Society is relief work or the relief camp. So whenever any disaster strike in any part of the India, so the Red Cross Society immediately they are going to take actions and they are going to provide the resources or the need which are going to be needed by the affected people. So they will do different various kind of the relief camp to provide the such kind of the facilities. Number two service which are provided by the Red Cross Society is milk and medical supply. So they are going to supply milk powder, medicine, vitamins or other supplies to the hospitals or any kind of the ballets, dispensaries, schools, orphanages, etc. So this is the second services which are provided by them. Number three service is armed forces. So they also provide care to the sick and wounded among the member of the force like army, BSF. So if anyone gets sick, they are going to provide in free of course by the Indian Red Cross Society. And number four is regarding the maternal and child welfare service. So under this agency, they also provide various kind of the technical advice or the financial aids of the scheme they're going to provide to the mother or the pregnant mother or after the delivery so that they can help or it will be helpful in maintaining the child welfare. Okay. And next one is family planning. So family planning is very needed in the India to reduce the population. So what they do means they have developed various kind of the family planning clinics in various places under the Red Cross Society. So through this they are going to give counseling or any kind of needed regarding the family planning will be done to reduce the population. And next one is they also provide the blood bank and the first aid. So they are providing whoever need the blood through their blood bank they can easily available the blood as well as for the first aid. And they have started St. John ambulance. Okay, St. John ambulance is it established in India as a part of the Red Cross Society. So through these associations they have trained many people's men and the women regarding how to take care of the how to take care of emergency treatment, first aid, home nursing, and allied subjects. Okay, so this is the six services which are provided by the Red Cross Society. So next national agency is Central Social Welfare Board. So it is established by the government of India in 1953, and this welfare board is established of there is having 33 states with this social welfare board, and till now 1800 or 18,000 NGOs is financially assisted by this board. So in this by this board, what are the services they are providing? Means first one is short stay home. They are going to provide short stay home for the women or girls like whoever need. Okay, for some period of time they don't have any place to go, so they are going to start this kind of short stay home. And next one is giving educations. Okay, they are going to give educations to the women and girls. And next one is they also provide scheme for the children who are working mother. So this that scheme is called Rajiv Gandhi National Scheme. And next one is they also have various kind of innovative schemes like poverty to reduce the poverty, gender equality in access of the health, education and training, child labor, women's, children's and women trafficking. And what are the activities they are doing to prevent to get the services? First one is they are going to teaching of the craft. Crafting is going to be taught to the women or girls who need vocational training. And next one is social educations. So social education is going to given in the large platform. And next one is literacy classes. Literacy classes is given literacy classes means these are the basic education that we are going to provide to the illiterate people, to at least they know the basic things, at least they know how to write their name, how to read the newspaper at least. And next one is they also going to provide the various kind of maternity aids or the various kind of the things, materials which are needed by a pregnant woman or after the delivery. Next one is they provide milk and balwardis to the need children in the village. They develop various kind of the play center in various villages for the children. And next one is they also provide supplement the family incomes by doing paid work. So they are also giving various kind of the activities in that they can the family members can be joined and they will get paid for the particular activities or the work. So next, we are going to discuss about the Kasturba Gandhi Memorial Trust. So this is established in 1945 and the central office or the headquarter is in Kasturba Vagram, Indore, and till now in India they have 22 branches and there is having 500 centers together whole India. And usually it was established by the Mahatma Gandhi to understand the issues of the woman or to reduce the issues of the woman in the rural India. So under this agency, the activities which are provided are first one is short stay home. So they are going to provide the home for the for the especially for the women who are with destitutes, no one or abandoned um, girls, widows, unmarried mothers, group of raping people aged between 15 to 35 years. So under this, whoever need there is no place to go, so they will provide a home. Okay, short stay home, that is called short stay home they're going to provide. And next one is they also develop Balwadi Center. So under this Balwadi Center, they are going to focus mainly on the children's coming under 3 to 6 years. They will be coming to this center. They will provide the basic educations by the Anganwadi worker. Okay, and they also will provide various kind of nutrients, food. Okay, snacks, etc. And next one is training institute is there. So they have developed training institute. In this they are going to provide various courses, especially they are going to focus on the tailoring or embroidery, and this kind of courses will be given to the girls or the women who need vocational training and they can earn the money. And next one is an institute coaching and making of the fiber and fancy articles. Okay, these all are the vocational training. Okay, so they are teaching the they are going to educate the people or especially the women regarding how to do making of fiber and fancy articles. And next one is they have Anganwadi training center. Through this they are going to call various kind of teacher and they are going to train them. The next one is they also have a maternity and welfare center with an operation theater. So in that 20 bedded hospitals are there. And next one is they also provide how to make coil, yarn, doormat productions and training. So this mainly they focus on the vocational training. Next agency is Indian Council for Child Welfare. So this agency established in 1952 and the headquarters at New Delhi. The next, let's see the activities done by the Child Welfare Agency. First one is they advocate the child rights. The next one is creches. They open the creches to care for the children of the working and idling uh, mother. And next one is they also provide training program for the child care workers. sponsorship for school educations for those children, underprivileged children. And next one, project for street and the working children, scrutiny of adopting cases, rehabilitation of the adopt children, institute daycare and the day center, institute and the daycare services provided, especially for the differently able children, program for the children in difficult circumstances, program with special focus on the girls child. Next, education center and the support services, honoring the child for bravery, honoring child artists, national integration camp or the adventure camps. Next agency that we are going to discuss is regarding the Bharat Sevak Samaj. So it is established in 1952. So this Bharat Sevak Sevas are sponsored by the planning commissions of Government of India. Mainly they are focusing on ensure the public cooperation for implementing government plan. So what is the purpose? Means to initiate a national-wide, non-official and non-political organization together. Objectives: to find out and develop avenue of voluntary service for the citizens of India. Next is to promote national service sufficiency and to build up the economic strength of the community of the country. Third one is to draw out the available unused time, energy or other resources of the people and direct them into the field of social and economic activities. Now we are going to see the activities which are done by Bharat Sevak Samaj. First one is they are going to focus on the people who are not able to get a proper facility, especially the underprivileged or the village area, that is reaching unreached people. The next one is skill-based training for all without any barrier. Next, education for all, one at any time, anywhere. They're going to provide the education in any part of the India. Next one is training to all through all possible mode use. They will use the all possible modes and they will provide training to the underprivileged or unreached people. The first major activities which are performed by the Bharat Sevak Samaj agency is improvement of sanitation, especially in the village. Next agency is the All India Blind Relief Society, established in 1946. The headquarters is located in Lajpat Nagar, Delhi. The services they are providing is, first one is maintaining a proper coordination with the different blind relief NGOs or any institute working, and next one is provision of any eye relief camp or other kind of measures for the relief of the blind. Next agency is Hinkut Nirvaran Shah. It established in 1925. So mainly they are focusing on the people who are having leprosy. In this, they are going to provide care as well as education regarding the leprosy to the people. Their headquarters is located in the New Delhi. The activities provided by Hind Coach Nirvar Sang is, first one is financial assistant. They provide a financial assistance to the various leprosy homes and clinic in whole India. Then education regarding leprosy by using publications or any kind of posters in the society. Provide training for the medical workers and physiotherapy who are taking care of the leprosy patients. And next agency is All India Women's Conference, established in 1927. Located headquarters is located at Delhi. They are mainly focused on the woman empowerment. The activities done by them is, first one is skill-based literacy program to increase the literacy rate of the women, especially in the urban or the slums area. They provide this kind of program. The next one is computer training program provided to the women's. Next one is supplementary schools of any subjects is going to provide to the women. Then next is daycare center for the street childrens, and in this they are mainly focused on the street childrens between 5 to 16 years. The next one is they also focus on the health and family welfare and populations. So for that they do health camps, awareness programs regarding the menstrual hygiene, mobile health van. So in that they will be providing services in the village at home. Next one is special care, especially to the pregnant mother or those who are expected mothers and their children's. Next one is anemia camp. So in the anemia camp, they will be doing mostly detection of anemia among the girls and the women, treating and follow-up action. Next one is socio-economic program. To build up or to improve the economic of the family members, they provide vocational training. Next one is they focus on violence against women. In that they provide the awareness programs about the violence against women among the peoples and what are the rights of the women. Next one is sexual harassment at workplace. They also try to control the sexual harassment at workplace. Gender sensitizations. So they do various kind of programs that will promote the gender equality with men and the women. Non-conventional and the renewable energy. So they trained and provide awareness programs about the energy conservation and the properly use of the energy by the people. Next, they also focus on the proper rural sanitation, water and waste management to prevent from this infection or communicable disease, disaster management, consumer awareness. Next agency is regarding Family Planning Association of India. Established in 1949, the headquarters is located at Mumbai. The services which are provided are: first one is gynecological service, infertility service, gender-based violence related service, laboratory service they provide, contraceptive services they provide about the MTP or the medical terminal of the pregnancy service. Then HIV related service like testing of the HIV, counseling and treatment regarding that they provide. Next one is regarding the maternal and child care services also they provide. Under these services they provide urine pregnancy test, antenatal care, especially injections, supplementary counseling, postnatal care, immunization of the children, and next one is general clinic for mother and the children. Next agency that we are going to discuss is Send Zone Ambulance. So mainly they are focusing on the saving the life at work, home and play. It was established in 1992 and the headquarters is located at Delhi. The activities provided are: first one is organizing training program. So training program will be focused on the topic on the first aid, home nursing, hygiene and sanitation, about the mother, craft and child welfare, disaster management, and other than that they have also provide services like ambulance, first aid services, awareness programs, arrangement of the first post or duties on various occasions, relief work during the calamities, organizing blood camp. Next, we are going to discuss about the Tuberculosis Associations of India. So it was established in February 1939. Headquarters is located in the New Delhi. The activities provided are quality diagnosis and treatment services for the tuberculosis patient, complementary supplementary for RNTCP, DOTS treatments. Next one is organizing TB shield campaigns every year to raise the fund, training the doctors, health visitors, health social workers in the anti-tuberculosis work. And next one is promotion of health education and promotion of consultations and the conference. And next we're going to discuss about the Ford Foundation. Established in 1936 in New York, New York and India it established in 1952. The headquarters is located in Delhi. The founder of Ford Foundation is Henry and itself Ford. So what are the support? They support the organizations who are taking care of livelihood opportunities, those or agency or any kind of organizations they are economically and social rights, government developmental effort, transparent and accountability, work to create agricultural policies, enabling women and girls to address their sexual and reproductive health and right, border the participants of marginalized group through public service media. If any organization working under these programs, then they are going to provide support. So what are the activities of the child welfare? First one is they are going to provide research program in the family planning, and next one is established at the national level regarding health and family welfare. They do various kind of pilot study for the project regarding health services, water supply and the drainage of the sewage system in Kolkata, and health. They also working on to remove child marriage in India. Next agency that we are going to talk about is Smile Foundation, established in 2002, and the headquarters is located in Delhi. So the programs and activities, first one is mission educations. So under this they provide education to the underprivileged children and education of preschool students, non-formal education, remedial education, bridge course, family life education for the adolescent girls. These are the main education which are coming under mission education. And next, regarding the healthcare, they provide programs like Smile on Wheel, Smile Health Camp, and for the livelihood, they provide Smile Twins e-learning program. And for the girls, childs, and women empowerment, they do various programs like Swabhiman, Pravantan, and next one for the relief camp also they do various kind of health camp. The next one is SOS Children's Village. Okay, so this agency established first in Australia in 1949. After that, it came to India in 1964, and it is located. The headquarters is located in Faridabad, and now around 41 branches of SOS Children's are present in India. So, what are the activities they are providing? First one is they provide child care programs. So under that they are mainly focusing on the family based care, family strengthening program, child protection right, educational services, emergency responses during the disaster or any help by the children. And next one is cry means child rights and you. So it was established in 1979 by Ripan Kapoor and his 7 friends. The headquarters is located at Mumbai. The work area they are working under regarding the right to survival, to life, health, nutrition, name and nationality for the children, right to develops of educations, care, leisure and recreation, right to protect from exploitation, abuse and neglect among children, right to participations in expression, information, thought and religion. So what are the activities they mainly do is bringing all the NGOs together, donation, time, resources, and they work together. And next one is mobilizing the communities to stand up together and demand for their rights. Next one is implementing awareness building measures, and they also partner with various kind of the NGOs which are present all over India and they do work together. Next, we are going to discuss about the Child in Needs Institutes. Established in 1974 by Dr. Samir Chowdhury. So, Dr. Samir Chowdhury is the pediatrician working in Kolkata, and the headquarters located at Kolkata. What are the activities coming under the agency is first one is education. They are in the education, they focus on the education of the children. So in that they do programs like Shikshalaya Prakalpa. In that they are going to focus mainly on the children between 5 to 6 years, and they also provide midday meal program. And next one is day for education are provided mainly to eliminate child labor in Kolkata. And next one is health and nutrition. First one is adopt a mother and save her child. So they are focusing, they are not only providing nutrition to the child, but also taking care of the mother. If the mother is healthy, that time only the child will be safe from any kind of the disease condition or the child labor. National aid controls programs also provided under this agency, and they provide Nutrimix. This Nutrimix help in prevention of the protein energy malnutrition among the children. And next one is face-to-face counseling they do. Next one is education people about the HIV AIDS, and they provide child lines, that is 01098. They can call if any situation occurs to any child, they can call in number and they will come to take care of the child. They provide shelter for the girls who don't have home. Sponsors, they provide sponsors for the children for the education, and also provide trainings to the local women's and government's worker. Training, emergency reliefs programs also provided under this. So they have a center. Okay, so this agency is running a center. So under this centers, what are the things they're providing? First one is they have the unit for the lactation management. They also provide nutritional rehabilitation center. Emergency wards is what is there in the center. Reproductive health clinic, antenatal clinic, thirsty clinic, outpatient department. So these are the departments and units which are coming under this center. So that was regarding the national agency. So in the next second part I will be discussing about the international child welfare agency. Thank you.